and your mental health. So before I start, let me acknowledge my first of myself again. I'm Anshuma Labi for this exciting opportunity and also great mission, a great commission movement of Ghana. My sister, we are grateful. Alpha Wave Consult for all your graphic designing. Look no further than Alpha Wave Consult. We are here to serve you. Once again, we are looking at other sponsors and supporters, that is House of EBQ for household detergents and more. Doug, you're once welcome. We are happy to have you on this show once again and to have and take us through this moment. Our doctor is already on our screen, our gentleman. In fact, I cannot please, you are welcome. You're so welcome to we are much happy, especially myself. We are happy, my your listeners are happy to listen to tonight. Please, your listeners, we are all listening to you. Good evening. Thank you.
Thank you very much. I want to thank you for the opportunity to share some words with them. Thank you very much. And thank you for the good also that I have for people. God bless you. And so this evening, I'm going to share with others who are not, I'm going to be very, very basic, touch on some issues, explain a bit so that everybody would understand. I would try and not be too technical about some of the issues. And so thank you very much. Please, I'm going to share my screen. And if you can see my screen, you would have to alert me. And at some point, I may ask whether I'm still on, so that I it's not gone. Because sometimes I'll be talking and not knowing I'm totally, the network is just. So when I ask, please forgive me, give me a on so that I know that we're on the same page. So I want to ask, am I on?
So please, we can see.
Yes, we can see.
Thank you. Thank you very much. So menopause is one of the experiences. I don't know why I'm the one doing menopause because I'll never go through it. And I've some of the things I'm going to share about women because I'm not. But I'm going to give you some practical things and basic things about menopause and mental health. So that's what I'm going to do. So men and women are different. Throughout the world, this is a confusion. It shouldn't be a confusion at all. Men and we're different. Our physique is different. Even without the skin, even without the skin, they look nicer, right? But our physique were different. Our muscle mass, different. Men have bulkier muscle mass than women. And bone density, the bones of men are a bit, bigger and heavier than women. And that is why when you enter a boxing ring with a man, for the woman to succeed, it's very slim. And the physical advantage is there. And it doesn't mean that men are superior, or women are inferior. No, it means we are this uniqueness important to make the world go round, right? And so we're totally different in many ways. And also physical strength, men and women are different. And this influences our capacity, our ability to do, our ability to function, and affects our growth. So men and women age differently because we're different. Though there are some similarities amongst men and women, generally we're different. Right? But unfortunately, throughout the world, people are making a big issue about whether a man can be a woman or not. Men cannot be like women. It just won't work. And you can dig up the bones of someone after 100 years, and you will know that it was a man or a female or a male, right? So we're totally different. And our DNA, our genes, XY chromosome, we're totally different. And our genome, the genotype, influences our phenotype, our outward expression in terms of function and all that. And this is basic science, right? We're different. And when you remove the muscles, you see deeper structures. So generally, if you look at when you look at all the structures, eventually, similar structures, but you realize that there are some differences when you look down there. So everything else, apart from the breast and stuff, look different. But when you look down there, you realize that females have a womb. Look at, they have a cervix, they have a vagina, they have a fallopian tube, they have eggs. And we're different. So male is a male, a female is a female. And they grow to become men or women. It's as simple as that. So a female, a woman is an adult female. It's as simple as that. And when you look down, we're different. And these structures we see, these organs we see, they are not just physical. They have functions. There are things they do. So the brain does something. If you look at the brain, different parts of the brain, you look at the chest, you look at the heart, you look at all that. They have a certain functioning. Men have the penis, they have the testes, they have the scrotum and all that. They have the prostate. So we're just different. And that difference is just in terms of physical difference. In terms of functioning, how the organs are functioning. If you look at enzymatic activities, if you look at hormone activities, if you like the reproductive organs and stuff like that, these differences create differences, right? And the differences are not just social. It is physical, biological. And those biological differences gives us the capacity to function and to do what we are supposed to do. And there are differences when it comes to the neuroendocrine system that particularly influences our mental well-being. So you look at the brain of women and they look similar, but in terms of their development and how the neural connections and stuff, you may find some small differences in there that makes women unique. So if you look at lateralization of cortical functions, you look at the brain, regions and how they function left and right, you realize that they are all specialized in many ways, emotional regulation and all that, right? And so men and women are different, and that difference impacts how we age. And that is the point of everything I've said. It impacts how we age, right? And so right from childhood, sorry, let me put this thing. Right from childhood, males. And as they age, the difference becomes clearer. And males grow differently, females grow differently. And the difference becomes very significant during puberty, right? When they are below 10 years, you realize that they may be different, not much. But the moment they hit, the changes began. And those changes, the physical changes, is based on internal changes, all the organs and what it's doing, right? That the person dies. So throughout the person's life, from the time the person is born till the time they die, right? There are all kinds of changes. Please, I hope I'm still on. I hope you can still hear me and I'm clear enough.
Yes, sir. Yes.
And so right from the time the child is a baby till the time that they die, there are changes. And these changes are not just physical, it is internal changes that is influencing external changes. Internal changes. External changes. Right. So if you look at particularly for women, during puberty, you realize that the physique actually changes. They become more streamlined. You realize that they become more curvy than women and men. Men become more muscular, even than females. Men become more masculine. Females become more feminine. And that masculinity or femininity is not just physical. There are internal things that are happening that is resulting in those changes. And right from the womb, the ability to become a male or a female is set. And all the developmental changes that happen is because they are genetic influences. So you find out that in addition to all the physical things changing, breast, it develops. You see small bats in there, maybe around the age 9, 10, thereabout, or even some people by 8, you see, the breast start developing. Puberty, it starts developing quickly. Then you realize that hair differentiations, male hair, a pattern becomes different, both in the armpit and down there in the perineal area. Hair distribution is different. So you look at female hair distribution, male hair distribution, it's totally different, right? And females may grow longer hair than even males, right? Even the texture of the hair is different for males and females, right? Then one of the critical things that happen is menstruation, because they have eggs and they have a uterus. And the capacity of the eggs and the uterus to be able to get involved in menstruation, it's not just the eggs or the uterus. It goes all the way to the brain. There are structures in the brain that releases certain chemical hormones that influence all the things down there and what to do. So menstruation starts. Sometimes some people may start a bit earlier, 10, 11 years, 12 years. And before you realize, they see blood, right? And when they see blood down there, you realize that the cycle is about 21 to about 35-day cycle. So some people regular 28-day cycle, but others may be more, right? And it may be between 3 to 7 days, right? These are normal cycles. Not just that, when it comes to cognition, there are all kinds of changes going on. The way women think is different. How they feel about things, their behavior, totally different. And all these things are biologically determined. Then again to environmental things. So it has the capacity to do the things that they have to do. And environmental things also influences, the depth and the extent to which those things are expressed. So there are all kinds of things happening, right? Then again to adulthood, when they get about 40, 45, you realize that fertility changes with time. So you realize that peak fertility is between 20 and 30. And that is why younger women easily get pregnant before marriage. But the moment they marry, pregnancy becomes difficult because a lot of ladies, for some reason, may delay pregnancy and marriage until after 30. The moment a woman crosses 30, everything starts coming down. Their capacity to reproduce starts going down because the eggs are aging. The pelvis, the uterus, the fallopian, the eggs, they start aging. So fertility starts declining sharply after 30. 35, it starts going down. 40 starts going down. And the risk for pregnancy-related complications and intrauterine kind of genetic problems actually increases, after 35, right? And so childbirth comes up at some point, and the capacity to give birth declines with age. Your physique has changed, your skin, mass, your shape, everything starts changing with age. Aging, adulthood comes all kinds of things, in addition to mental health problems. So mental health issues actually is there. Apart from, seeing mental health issues, go very, very high in the adolescent years, around 18, about, you may see some peak. When they into 25, you see a peak, right? Because of all the, environmental issues and social issues and risk factors in their family, work, or whatever, and as people age, we are talking about women. So as women, with all the experience and the troubles and the problems and work-related issues and physical changes and hormonal changes and stuff, you realize that all kinds of mental health issues come up. It comes up with the person. So not just physical health issues, but mental health issues also start coming up. And some of the mental health issues even have some genetic linkage. But the moment they get older, about 40 years, to elder above 65, menopause becomes important. Menopause becomes important, and we'll go into a bit detail very soon, right? And menopause typically around 3 years for many countries, but the influence and the age, varies. Ghana, you may find it in the mid-40s, 43, 44, 45, 46, they are about. Some may have early in their late 30s, some up to about 55. So when people cross 35 years, because of all the changes happening and the quality of that, before you realize all these hormonal changes, is creating some kind of, changes in their body and physically. That initiates the phase of menopause, right? And so diseases also come up, hypertension, diabetes, cancers, and all that also come up. Sometimes some of those things is based on lifestyle, genetic issues, and all kinds of stresses in life. Then in addition to that, there are brain changes. Your brain not the same the years. The declines with time because multiple brain area changes. It can be related to lifestyle or genetic things or exposure to all kinds of chemicals or radiation. The brain also infections like HIV and all kinds of things. The brain also goes through changes. Alcohol, smoking, and those things impacts the brain significantly. So with your capacity to remember, to judge, to think, to memorize starts. For some people, the changes are so significant, they may have neurological problems like dementia, Parkinson's disease, those things. All kinds of changes, including menopause, women, andropause for men, because of declining and changes in hormones, right? Hormonal change, because of hormonal changes, right? All these things they may start experiencing. So when you look at the brain is an amazing structure, very, very complex. The parts of the brain, very, very diverse, very varied, and every part of the brain and what it does. But when it comes to hormonal things, you realize that the hypothalamus is very, very, very important. The hypothalamus, if you pick, at the base of the brain, there are structures there. It influences moods and right. Hypothalamus is very, very, very important. Releases all kinds of hormones. And these hormones actually goes to another structure, right, at the base of the brain, which is called the pituitary gland. It has the one that is behind and the one that is in front, anterior and posterior pituitary gland. These are very, very important structures of the brain that releases certain hormones. These chemicals influence distant of for those organs to function, right? And so you have the hypothalamus releasing hypothalamic hormones. There are several of them. And this is not a science lecture, so I won't go into that, right? There are several of them. Some influences anterior pituitary gland and posterior pituitary gland, and they help organs in the body to function well. So for a woman to be able to be a woman, it is not just physical or you go or something. Internally, all kinds of changes are happening. Right. So the pituitary gland, anterior pituitary gland release growth hormone that influences bone and muscle and other organs so that they can grow. Right. Prolactin is released to influence breast and stuff like that. During intimacy also, prolactin is also released. Right. So breast, ability to produce breast milk. Prolactin is also involved. Then luteinizing hormone, right? LH is released and it influences the ovaries and the testes. And the ovaries release a lot of estrogen, particularly after the puberty, during the puberty onwards. Estrogen production goes really, really up to influence and stimulate female secondary sexual characteristics. Progesterone is also released. So the eggs down there is not just releasing egg for fertility, but the eggs are influenced to produce certain hormones that makes a female become a female, live like a female, have feminine features, right? Then with the follicle stimulating hormones, FSH, right? That also influences both the ovaries and the testes, right? To release this hormone. So the males should have a lot more testosterone. Though you may find estrogen and testosterone in both males and females. You have more testosterone in males and less of estrogen. Then you have the same with vice versa, if I put that way, with males, right? Then the others, I will go into that. That helps release all kinds. So all these chemicals with thyroid and stuff, thyroid stimulating or ACT and all that, particularly under stress and all those things. All these new chemicals are released, right? Then the pituitary releases oxytocin and all that, during sex and stuff, the pleasure and stuff, all these chemicals are involved, right? So for a female to be a female, there are internal things going on that influences that process, right? So estrogen and progesterone, very, very critical for being a female in terms of your development, right? So the maturation of your womb, your tubes, your everything, and your ovaries and everything, your vagina, the activities of your vagina, whether they are producing fluid or not, whether they are, expanding or not, right? And the contraction and all those things, menstruation and those things. the estrogen and progesterone are the ones that help with that, right? Without that, you realize that menses may not never come, and again, it may be irregular or it may skip and all that. So when a female has, menses that is not regular, is skipping and all irregular and all kinds of things, may be a sign that they are problems. The estrogen also influences secondary sexual character, like the growth of the breast, widening of the hips, and buttocks and all that. So all these things are necessary happening because of these hormones, right? Then systemic issues, apart from the fact that it helps with reproduction and all those things, it also helps in other organs in the body, right? Estrogen helps to protect the cardiovascular system, right? If you look at the vessels and how they function, blood vessels, whether they are flat, estrogen actually helps. In terms of your cholesterol, metabolism and control, estrogen is very, very important with that. Then again, to help with bone density and mass. And that is when during menopause, people's bones actually become a bit weaker and it can easily break. Progesterone also has estrogen, progesterone, very, very important. And when it comes to, what we are talking about. But these levels of estrogen, it's not the same throughout life. It changes with life. So around the puberty area, it increases sharp. So from childhood, it's a bit low, then it increases sharply, right? Then after the 30s and stuff, it starts declining. After 40, it becomes very, very erratic. So you realize that those who are premenopausal, they will tell you that their menses is not as to be. It comes, it skips, and that kind of thing. So before you realize that the amount is decreasing. So the reason why menopause happens is because estrogen levels are going down with age. Fertility starts going down. Everything starts going down the hill. It has its own health problems. Realize that the amount actually increases, then it starts decreasing, until it's really, really low, right? And that is what menopause happens. So the level is influenced by menstruation. During menstruation, the levels change, pregnancy, breastfeeding, aging, and stuff. But the levels of estrogen actually fluctuates, right? And that fluctuation may influence some cancer development, like breast cancer, those things. So when you look at female sex hormones, the estrogen we talked about, the brain influencing its production. In addition to that, there are certain structures in the body that actually helps produce estrogen, but in smaller amounts. So fat cells are there, adrenal cortex are there. Then we talked about the estrogen under the influence of luteinizing hormone or follicle stimulating hormone. Then again, the placenta. And when the woman is pregnant, the placenta actually helps. But there are three types of estrogen. We have the estradiol, estrogen, and estriol, right? These three hormones, types of estrogen, actually produced in differences at different phases of the woman. And that is significant in terms of changes that I've talked about the woman's life, right? And so estradiol is what is really, really important. And the levels are very high during the puberty and stuff. And it helps the secondary sexual characteristics I've talked about. Estradiol helps with those things significantly, right? And when you look at what do you call it? So the reproductive period, the estrogen and progesterone, estrogen is produced and progesterone, very, very important. During pregnancy, the placenta produces the third type of estrogen, the estriol, right? The placenta produces it, right? Then the progesterone is also there. Then afterwards, when menopause begins, fat cells and adrenals takes over the production of the third type of estrogen, the estrone, right? But these numbers are very, very few. You need the estrogen itself, estradiol itself, to maintain all the feminine things we talked about, feminine features we talked about. But during menopause, it's tied down, and the levels are very, very low. And that is why they have all those menopausal symptoms that we're talking about. Because without that, the body is not able to function well, like I talked about. So during menses, estrogen levels are different. Around the what you call the ovulation period, estrogen is very, very high, and it starts dropping, right? That may be responsible for some of the mood issues around menstruation and stuff like that. Premenstrual dysphoric kind of problems. So you have it surges around the peak 14 day. And women will tell you that around the ovulation time, the libido is very, very high. Libido goes very, very, very high, around the ovulation period, right? So some women can tell, when they really have high libido and the feelings are there, they can even tell that it's around the ovulation time, right? So even when it's menses, you realize that estrogen are different. Then pregnancy, we talked about placenta, taking over in terms of production of estrogen. But what is produced is called estradiol, not the normal estradiol, not the normal estradiol for what we've talked about, right? Then prepare the breast for lactation and stuff like that. So during breastfeeding also, you realize the estrogen levels are down. That is why they will not have their menses until after some time. So breastfeeding actually also helps. And so, for example, when it comes to breast cancer, the estrogen influences the breast cancer development a lot. So pregnancy is protective, breastfeeding is protective. If you start giving birth early, it's protective. Give very late in life, or you never give birth, your risk of breast cancer actually goes up, right? And early men are key actual breast cancer issues and all that. Because of estrogen production. So estrogen levels vary. Then when it comes to menopause itself, you realize that the follicles and stuff, ovary actually loses all its eggs. Everything starts going down. Hormones are not produced. So estradiol, which is necessary for maintaining femininity on many levels, is gone down. And that is why they start feeling all the things that they are feeling. So all the activities I've talked about starts going down because estrogen estradiol is not there. And that is when they have some symptoms I'll talk about in a minute. Then after 50, estrogen is the one that is being produced. And then levels are right. So menopause is when menses stops. And usually we diagnose someone to have menopause after 12 months. So in the first few, when menopause is quite erratic, then and we wait for 12 months to be able to diagnose someone with menopause. So when menses ceases for 12 months, there will be someone as menopause, right? And they may have, this vaginal bleeding and spotting here and there. But it's natural, it can natural, right? In terms of the causes for menopause, it can be like aging I've talked about. So someone is aging, is in their late 30s or early 40s or mid 40s or late 40s or early 50s. And menses, that is the natural progression. That is what happens. But people, for some surgeries where the ovaries are taken out, what it means is that estrogen production go down. So they have early menopause, chemotherapy for cancers, right? Eggs can be affected and they have menopause. Then some people, about 1% of the population, the ovary actually is not producing enough estrogen, and because there are problems to the ovary, right? So all these things can serve as a risk factor or a cause of menopause. But majority of the time, before you realize, it's just aging, the natural progression with age, right? And when that happens, because of the reducing of all the hormones I've talked about, then all the symptoms come up. Because estrogen is necessary for virtually a lot of processes in the body, right? So in the absence of it, symptoms. So if you look at it carefully, they may have some other problems, irregular heartbeats, breast pain, and all that, bloating, stress, incontinence, vaginal dryness, joint pain, and the bone becomes very, very porous, so it can be nice sweats. I wonder how older women survive. Remember when my mother, fresh menopause, we used it. That's how to suffer, no, I shows them. Right? But it's a very, very tough time. Very, very tough time for women. I wonder how to survive. They may have anxiety, depression, hot flashes, mood swings, irritability, there's some hair loss, difficulty concentrating, headaches, migraine, dizziness, gum problems, and all that. So they may have a multiple of symptoms. And sometimes elder woman comes and they don't even how to describe how they feel. They can't even explain how they, because the symptoms are all over the place because estrogen is not there, right? Or the levels are significantly reduced. right? So when it talks about the brain itself uses small estrogen and just to maintain its own growth. So a one that is produced by the ovaries and even conversion of testosterone to estrogen and stuff like that for males, right? The brain actually produces a bit of its own estrogen. And boys, you realize that when kids are kids, right, at a very early age, boys produce testosterone, and testosterone, part of testosterone, is actually converted to estrogen and develop. But females, there's that, it may not be there, in terms of the amount of males. So you realize that estrogen levels for females may be even for males. Right? It may not be as supposed to be. But during puberty, actually the estrogen production really goes up. Really, really good. And realize that estrogen actually and shapes, right? So, for example, hypothalamus, which is anger, mood, and sex drive, there are certain parts of it that is bigger in females than in males. Some of them is bigger in all that. And all things influences sex drive, influences secondary sexual development, characteristic development, and all that. So the brain itself, is impacted by estrogen levels, right? And estrogen is necessary for the production and also the breakdown of what do you call it? Important neuro is a neurotransmitter that is very, very necessary for our mood and stuff. And when you look at certain efficiency and stuff with things like depression and all that, serotonin is very, very important. Yes, serotonin is very, very important. Right? So estrogen influences serotonin levels by increasing its synthesis and reducing its breakdown so that you have enough serotonin, which helps with the mood of a person. So if estrogen levels goes down, it means that serotonin levels will be affected. Protection, estrogen protects central nerve, the neural stuff like that. Neuronal survival and plasticity. And plasticity basically is the ease with which the brain is able to reconnect and rewire itself in order to adapt. So, for example, someone has some injury, right? The brain is able to recover some function. In terms of growth, there are all kinds of neural connectivity that goes on that helps a person function in basic terms. And this is important for health. And estrogen for all these functioning, right? So it affects them. It's a risk factor for mental health disorders, example, depression, schizophrenia, and others, right? So if you look at perimenopausal depression around menopause, estrogen fluctuation during a menopausal transition is linked with increase of depression. And there are all sorts of research that have been done. That 2 to 4 times likely for depression when there's is menopausal period, and it's higher in women with depression. So itself increase because of estrogen decrease. But if someone has depressive illnesses for incidence of depression will be higher, right? So estrogen is important, and there was a study that was done. People who were depressed and what do you call it? Menopausal kind of phase. And they realized 68% extra experience remission of depression compared to 20% in the placebo group. What it means is that estrogen influences even the treatment of depression. And now there are all kinds of drug medications that are given to be able to help with estrogen deficit. And antidepressant benefits were sustained even after discontinuation. You call it the antidepressant medication, right? Okay, then it comes to schizophrenia. Adding estradiol to antipsychotic significantly reduce positive and general pathological symptoms. So positive symptoms like hallucination, delusions, and all that, those are positive things. Positive and negative symptoms. Negative symptoms like anhedonia, poor self-care, and all that. But the positive symptoms with schizophrenia and those things, even administering estrogen medications with antipsychotics, they found out that there's an improvement. And also estrogen, particularly estradiol, has been found to have protective effects in women vulnerable to schizophrenia. So when a woman is vulnerable to schizophrenia, estrogen actually medications can help reduce the risk of developing, what do you call it? Schizophrenia. So mental health issues are significant when it comes to menopause, because estrogen and estrogen levels are very, very important to maintain the person's mental health. So when people have menopause, they have hot flashes, nice sweat, irregular menstrual periods, vaginal dryness. So sex and eating with their spouse becomes very difficult. Loss of libido. Unfortunately for men, though libido goes up, but it really never goes down too significant. Last time a patient came to see me, 85-year-old man. He was a doctor. That's me power no abofum. Let me say, grandpa, you will die. 85-year-old. But it's not like that with women because of all those changes. And imagine a man like that with a wife who menopausal and stuff. There may be some conflicting problems at home, and because of the mood swings, irritability, depression relating with the panic attacks, fatigue, before they become easily irritable and stuff like that. And it may affect their relationship with their spouses, it may affect their activities at work, it may affect their relationship with their kids and all that. So menopause is a big risk factor for mental health problems. And so other complications may be about bone issues, loss of bladder control, they may have some urinary incontinence, sex-related issues I've talked about, then weight gain. But let me sound this caution that when a person is diagnosed with menopause, we don't expect them to bleed. Any bleeding right after menopause must be investigated because it may be cancer from any of the structures down there. It may be cervical-related cancer, endometrial-related cancer, vagina-related, some cancer of a sort. Right? So if someone has diagnosed with menopause and they see any blood, it has to be investigated to exclude cancer from the reproductive system down there. And one of the things too is so to end, how do we go about it? It's you need a holistic approach to be able to manage anybody who has menopausal problem. In the menopausal thing, you didn't choose it. It's not like it's a disease, but it's a door to many diseases, right? And if your symptoms, some people may have milder symptoms, others may have very significant symptoms, right? So if menopausal symptoms are really overwhelming, it's affecting your life, what do? Medications. There are medications to all those hormones and medications to deal with mental health symptoms, depressive symptoms or anxiety symptoms or stuff. Medication. Then supplement. They give you all kinds of supplements with all kinds of vitamins and calcium and vitamin D and all kinds of to be able to balance deficits and to be able to help manage some of those things. Then therapy. When someone going through some depression, anxiety, a counselor, a psychologist, or some therapy to look at the issues and what it is. So CB kinds of therapy initiated. Then lifestyle, things that people can do on a day-to-day basis. Without flat like that, it means clothes, right? You have to wear lighter clothes and stuff. And if it's your old house, sometimes you may not even wear something on top. You may have to wear something short, and maybe when you are sleeping, you may not have to wear anything, right? Just to be able to help with the hot and stuff like that. We can help down there just to be able to eat the dryness that is down there. Sleep. Don't be affected by menopause, but we expect that people should spend more time resting and sleep. We like all kinds of relaxation exercise that can be done. Exercise, pelvic floor exercises and all. And again, to diet. There are all kinds of diet, cereal, carrot, whatever, diet with calcium, with omega-3 fatty acids. and all that. So fruit and veggies, it helps significantly. You may have some dairy, but you need to reduce fat and all that. Fat-related products, we have salt and all that. You may have to reduce them. You have to reduce them. Then again, you need to avoid alcohol smoking, because all those things make your health worse during menopause, right? Then you would have to also try and lose weight. So, but if for some reason you realize that you are very, very overwhelmed, things are very difficult for you, so difficult for you, and you don't know what to do with your life, things are very, very challenging and all that, please walk into any hospital. When you get to the hospital, the nurses will let you see a doctor. The doctor may start whatever they have to do. They may refer you to see the counselor psychologist in the hospital, refer you somewhere. The obstetrician and gynecologist may attend to you, give you all kinds of medications and just to help you. But if you are in the phase of menopause, you are not alone. You can receive the right treatment if you walk into any hospital. So thank you very much for your time. Do have not experienced any of these things I've talked to you about. I hope I make sense. Thank you very much and God bless.
Thank you.
Before we take any questions, I would like to say talk a little about our doctor, Dr. Isaac Newman Arthur. He's a senior medical officer, psychologist. He's been a psychologist for 4 years and has an experience currently. He's the director of the medical directorate of the University of Professional Studies, Accra, and also the professional relations officer of the Ghana Psychological Association. He's also a part-time lecturer at the Public Health Medical University, Central University, and then the Daniel Institute. He serves on various boards and tertiary institutions and non-governmental organizations. He also provides consultancy for various health facilities, including Navigator Medical Center. I hope that whatever challenges we're having right now, doctor will be able to assist us when we enter into some of these facilities I've mentioned. Right? He's also an author of books on mental health and others. So I would like to end here. Doctor, thanks so much for the massive education on how our bodies change over the years. We are so grateful for the massive work done. Thank you so much. Can we give some reactions to Doctor? Sorry, can we show some love? Some reactions to Doctor. Thank you so much. So before I move on, I have one chat here. Please, if you want to ask any question, you can show your hands. From Lesbon Farm says, thanks so much for the presentation. Yeah, I really enjoyed myself. Thanks so much. So any questions? Any questions to help us? Okay, so in the absence of no questions from okay, so I have some few questions here. Okay, from Jones, he says, do you have anything like early menopause? If yes, at what age can we say so? All right, so Doug.
So typically, menopause, a lot of countries may be around 50, late 40s, around late 40s and early 50s. Around 50, they are about. But if someone starts late 30s, we say early menopause, right? So 38, 39, 40, they are about. We may say early menopause. In Ghana, like 43, 44, 45, thereabout. Every country is different. Maybe because of lifestyle issues, genetic issues, and stuff like that. But it's different from country to country.
Thank you so much. Please, Mr. James, I hope your question is answered. And his second question says, is there any likelihood that someone in menopause gets pregnant?
No. So you can't have menopause. You can't be menopausal and give birth.
Okay.
The sign give birth. So you can't give birth unless you are Sarah. Unless you are Sarah in the
I
Bible.
get you, right? All right. So, why is plenty talking associated with menopause?
Yeah, because it's a serious thing. If you're a man, you don't understand. But if you're a woman, all the changes and all the symptoms that I talked about, some people can be very, very, very worse, right? And so it's change for the woman. And that is why there's a lot of noise. If women are educated, they are aware of it, then it helps them go through it well. Okay.
Okay, Doc. So, before his last question, I would also want to ask, how would you describe the impact of menopause on the daily life of an individual living with menopause?
How would you describe?
Yeah.
Okay, so let me say, maybe when my mom started menopause, one hot flashes, very irritable, mood swings, um, difficulty concentration, paying attention, um, basically these things. And depending on the severity of the symptoms, it can be worse than I'm talking about. But these are day-to-day, examine here and there, weakness here and there. And some of them may think a certain disease. And that is how come most of the diagnosis of menopause comes when the menses are not happening, or they come and they feel unwell, but they cannot pinpoint anything. They come and the symptoms are all over the place. And the doctor will say, no, this is because of menopause. So it can be very, very serious. Yes.
All right. So, I'm taking his last question. Can risk factor to dementia?
I haven't read any article that tries to link. I may have to check it out.
Okay.
I haven't. I may have to check it out.
All right, Doc. So with my last question, I would also ask, how can we socially help our mothers with living with menopause? How can we help them during this challenging um, moment in their lives, rather than saying, oh, and I'll casadodo, and you talk too much and keep ignoring them and all that? You know, talking about mental health is really going to affect them because they know themselves not to be people who like talking. All of a sudden, they are talking, they are nagging, they are yelling, and all that. How do we help them socially? Thank you, Don.
So I think that first of all, if you're a female, you need to understand that one day you also get there. So whenever you are telling your mom that, we know that you're also on your way there. But it starts with providing some kind of social support. Understand her, be there for your mother, encourage her, help to hospital, help her get her medication if she needs medication. Social presence and chatting and support and feeling of care and stuff would help the person, particularly the mental health related problems.
Okay. All right. So, Fanami, thank you, dog, for your kind presentation. Most High and Christ bless you.
Thank
So, that's for you, dog. And Jokers, please, is it likely to get a soft copy of your slides?
Okay, I'll send it so you can You can I'll give you the organizers. You can get in touch with them.
Okay, thank you. Gold says, are there medications one can take before menopause?
Well, so before menopause, medications are not necessary. Start the menopause. Let's see what is happening. Then based on that, the doctors will prescribe. So we don't say, oh, we are prepared for menopause. But generally, if you have a healthy lifestyle, you shouldn't worry too much. When menopause starts and there are problems, then we try to deal with it.
Okay, thank you.
Is it possible to see the hand that is raised for the past 5 minutes, I think?
Okay, sorry. Okay, please, can you answer, ask your question, please?
Thank you very much. And I first of all want to say a big thank you to Dr. Newman. And I case this more to looking at people within the mid-45 age range who probably are still looking for children. And we do know that from what he said, down from about that age. So is there any help for such people? Because you may at counseling encounter cases like that, and you need to be able to say you can do A or C. So, Doc, is there any help or for people to maintain or find help in increasing their estrogen, even though at that age it is supposed to be naturally going down? Thank you very much.
Thank you. Aging, the moment menopause hits, there is nothing we can do in terms of natural. But when a person is older and still having their menses, and pregnancy is not happening, what usually we would advise is to do artificial kind of assisted reproduction. And so they may have to do the IVFs and those things. So that is we would ask.
Unfortunately, I'm losing you and I can't hear your responses.
Yeah, so what I'm saying is that a person is around menopause and all the things are happening. Nothing is difficult. We may have to sometimes they may give them some medications to increase their eggs and stuff like that. But ultimately, some form of artificial reproductive, assisted reproductive kind of method like IVF and those things is what may work out. But until menopause, a woman can give birth if there are no other issues, right? But around the time where everything is going down, the doctors may attempt to help, boost the eggs and all those things. But ultimately, what really may help is the artificial, kind of thing. And even with artificial, with advanced age, the failure rate is very high. The failure rate is very high. So a gynecologist and obstetrician and gynecologist would have to attend to the person. And they would assess the quality of their eggs, looks at all the risk factors around natural birth, do all kinds of labs and tests to find out whether it's possible. If they can help boost the eggs, they may do that. But if it will not work, they would they would suggest the assisted reproductive kind of technology.
Thank you very much.
You're welcome.
All right.
And that is why, let me say this, that is why, you see, when you're a female and you can say, oh, then time now be worry, and now you are married and your parents are asking, oh, when are the children coming? Sometimes it is not out of spite or just societal norms. Sometimes the wisdom behind it is that you are growing, you see, and your fertility is going down. So sometimes, particularly women, that if making babies is part of your plans, there are some women who really don't care whether they have kids or not. I'm not talking about those people. If you're a woman and you making babies is part of your plans, you like it, you want to have babies, don't delay it unnecessarily. Right? These people, it's not their fault. Maybe they are not married, they don't want to have kids and those things. It's not their fault. But there are some people who are just pushing off marriage, the idea of marriage. They think they have time. There are some women who are, even though they are married, they are delaying pregnancy. By the time they realize, now when they are really ready for it, it will be just too late. So if making babies is part of your plans and nothing else apart from some of these reasons is not stopping you, then it's better. And when you marry, it's better to even suspend a PhD and have your baby than pursue PhD and later on you don't even have the capacity to have babies, if making babies is important to you. So that is the advice you will give. Because a woman has an expiry date when it comes to making babies. Okay.
Thank you, Doc. Jones Akwesita Boy again is asking, please, with those who change their gender, a man into a woman, hormonal interference, any likelihood that they face these symptoms?
So if they are males, so if they stop the hormonal actions, they are males. But what happens that if it's female and they decide to become like males, if they are females and they decide to become like males, they do all the surgeries and all that, then they will start having menopausal symptoms and they have to be on hormones for life.
Okay.
But if it's a male and they stop all the female hormones, when they stop it, they are still males. The body will recover with time. But if it's a female who went through all kinds of reasons, hormone thing, and they became males, right? They will start experiencing early menopausal symptoms. And when they stop the hormone things with, they will start having those menopausal symptoms early.
All right.
So
how much?
So they will be dependent on the medical system for life.
Doc. Hamadi Sobi is also saying, thank you, Doc, for that insightful discussion. In my country, in Gambia, Efe, please, I'll call you in a bit. Thank you so much for your patience. And in my country, in Gambia, menopausal issues are rarely talked about. Now, my question is, how does one start health promotion and advocacy around the sensitivity issue, where sex and sexuality is difficult to discuss?
How can someone what?
How does one start a health promotion or advocacy around the sensitivity issue where sex and sexuality is difficult to discuss?
Well, there are two things I will say. I will tell you that part is not an easy. And so, because it's a very contentious issue, the issues around it and the influences on various levels on those particular issues, you would have to brace yourself for challenges, for opposition, for all kinds of things, because you will face oppositions. But if you are on some level of impact in that area, and you don't really care about all those things that may come up, then you are ready to go from there. It starts from there. And secondly, you need to be totally convinced about the message you want to put out there. Totally convinced and have all the facts you need to be able to be effective in that space. Without facts, without the truth, without objectivity, there is no way you are going to win any argument. Right? Those two things I think will help. Position yourself in a way that when you start it's and it's a very, very dicey area. You should really be prepared for the impact. But it is very, very possible to make a certain impact, because really anything that affects society, you need human help fix it. And probably you are the one that God has chosen your country to help fix those issues. So I want to encourage you to take that step. But know that it will not be easy. It will not be. It's a very, very challenging area. And prepare yourself, be factual, know all the facts, be convinced about what to carry out there, so that the challenges doesn't break you easily. So that's what I would suggest. Then link up with people who are already in that space and are doing well, so that they can provide some information and support for you whilst you embark on that journey. But it's possible.
Okay, so before I call Auntie Efe, I would like to acknowledge Ghana Psychological Association for their massive support and collaboration. Supporters Great Commission Movement, House of EBQ, Alpha Wave Consult. Thanks so much for your mass support on our Wellbeing show, that is Purple Wellbeing show. And also thank you, Dr. Auntie Efe, please, you have the platform. Thank you.
Thank you too. Thank you. Good evening, everyone. And thank
Name.
you, Doctor, for the insightful presentation. I would like to find out from Doctor, after menopause, does the body still goes through the process of probably ovulation, wetness, tender without any blood flow?
No,
Does the body still goes through that process?
no, the body doesn't. When it starts, it's just for life.
Okay.
It starts for life. And like I said, you are supposed to see any blood. The moment you see blood, when you have been diagnosed with menopause, it has to be investigated. It may be cancer of any of the structures down.
Okay.
Okay. Thank you.
Thank you very much.
I would also want to engage my listeners and recommend that you reach out so much on Doctor on our TV shows and radio discussions. You follow him. He's been engaged on so many radios like the News, Printing, the Consulting, hosting Assassin Radio, and also past TV host for mental health programs on Ocean One TV. So you can, in fact, you can follow and have great discussions with Doctor on his radio shows and others. Thank you so much. I'll take more questions for Doctor. All right. Any more reactions? All right, Doc, my personal question. I would also want to ask, so looking at the menopausal thing, what is the appropriate age for women to get pregnant?
Your peak fertility is between 20 and it declines, from 30. By 35, declines sharply. So if there's something about pregnancy that you are thinking about, it should be below 35. But when you start maybe late 20s, mid 20s, late 20s, early 30s, it helps. It's not just becoming pregnant, even pregnancy-related complications with the baby, with yourself as a mother, hypertension in pregnancy, diabetes, fetal abnormalities, and all that, preterm delivery, and all kinds of things. Autism risk goes up, issues with Down syndrome. With age, a woman, your fertility and reproductive, it just goes down. So if making babies is plans, then it's better you suspend some PhD and make babies. Because in PhD, even if you are 40, you can do your PhD. But pregnancy is difficult.
Okay. Madam Efe, your hand is still up.
I think the old ham.
Okay. All right. No problem. Okay, Doc. Thanks so much for hosting us and talking to us on this powerful topic. We are so grateful. And once again, we come your way, Purple Wellbeing Show, in collaboration with the Ghana Psychological Commission. We will end our show here. Thanks so much, Doc. We really appreciate. We really, really appreciate. Thank you so much for your time, my listeners and supporters, Great Commission Ghana, House of EBQ, Alpha Wave, and our beloved doctor. Thank you so much for your insightful, educative program. shared with us this evening. I would like to also thank my listeners for making time. Thank you so much. Meet you on another day. Bye.
Thank you.
Thank you very much. Bye.
Bye.
Thank you very much. Waiting for the slides.
Sure. You get it tomorrow.
Okay.
God bless you. Thank you.
Thank you
We are
too.
grateful.
All right, sure.